Okay, so we're going to talk about lifespan changes within the reproductive systems, but we're also going to talk a little bit about sex. Okay, so we're going to talk about the sexual response and then the changes that occur with menopause, andropause, and as well as birth control. The order of this is a little weird, but I'm just using the order they've got on these objectives. This one should probably be first, second, third, and fourth. Anyway, okay, so when it comes to the sexual response, both sexes, male and female, have 4 phases. So it starts out with the excitement phase, and so this is where the genitals, so we're talking about the vagina, clitoris, penis, are ready to come together, okay? And so they become erect or engorged with blood, and then the vagina also secretes fluid for lubrication. Then plateau is reached, which is where these changes intensify, and then finally there's orgasm, where a series of muscle contractions, like it says here, or also it's often referred to as climax. And so what's going on in that case is males ejaculate. So the sperm leaves the penis, goes into the vagina, on its way to, hopefully find an egg. At least that's its job. Whether or not a person wants that's another story. And then to help the sperm along, females, the vagina of females contracts. And then finally, after all of that's been done, you have the resolution phase, which is where everything goes back to normal. And this takes a little bit of time. Okay, so let's talk a little bit about men here for just a second. So with the penis, normally it's flaccid, and this is occurring due to vasoconstriction of arteries into the penis. All right, so it reduces blood flow, it doesn't fill up with blood. However, when it's erect, there's vasodilation, and what actually happens when you vasodilate these arteries is that it actually pinches off the veins that prevent, and so what happens is blood is not really able to leave the penis. Okay, now notice that the erection is a parasympathetic response. Okay, so we dilate those vessels, and then, like it says here, the veins compress because the penis is filling with blood. Okay, so because blood can't leave, it remains erect. Then we have ejaculation, which there's two phases to it. So one, you've got emission. And so what's happening here is this is a sympathetic reflex. And so what's happening is there's contraction of several things, including the reproductive ducts, the accessory glands, as well as the internal urethral sphincter. Okay, we talked about that with micturition. Okay, that's something that is under involuntary control. Now, some people have wondered or have asked, hey, does this mean that semen and urine combined because they're both kind of coming through the same place? And the answer is no. All right. So then with ejaculation, you have expulsion, and that's where semen leaves. And this is due to a spinal reflex. So this is involving skeletal muscle, somatic motor neurons, but it's not really something that it's a reflex, so it's involuntary. And then once that happens, resolution occurs. And so what happens with resolution is those arteries in the penis constrict. So that stops compression of the veins. And so blood is able to leave the penis and it goes back to normal. Now in women, there's a lot that goes on before and after orgasm. So like we said, or like I said a minute ago, so there's increased blood flow to the clitoris, breast, nipples, breathing increases, heart rate increases, blood pressure increases. Okay. And then ultimately what happens is there's contraction and relaxation of different muscles, as well as production of lubrication from the vagina to make that process a little easier. And women do, in fact, ejaculate as well. This comes from what we call the female prostate. It's not to the same extent, nor is it as obvious as what happens in men. With men, similar in that there's a large rise in ventilation, heart rate, blood pressure. But as soon as orgasm occurs, there's what we call abrupt resolution, right? Things go back to normal, guy falls asleep. All right. Ultimately, what's really happening is that the smooth muscle relaxes, which allows for that engorgement, but then they constrict to get blood flow or to allow blood flow to go back to normal. What's also interesting in that men, and this might not be surprising to some of you, is that their brain essentially turns off during orgasm. And so from there, we're going to go transition to menopause. I know, super exciting, right? So what is menopause? Well, menopause is when women lose reproductive capacity, okay? And so physiological changes that are involved or associated with this are a lot. Like everything that's on here is a symptom of menopause. Okay. This is, there are some big changes that occur. So they include, but aren't limited to, hot flashes, weight gain, soreness, mood swings, dizziness, among other things. All right. And so what goes on before menopause actually happens? Well, women will still have menstrual cycle, but it will be irregular. Okay. The egg cell or the ova will have reduced quality. All right. Meaning it's hard to fertilize, harder to maintain, that sort of thing. And so this is oftentimes why women that are a little bit older have more difficulty getting and then maintaining a pregnancy. I believe the age is 35 when they refer to, if a woman is over 35 and pregnant, they refer to it as a geriatric pregnancy. I'm not sure who decided that was the cutoff or that that's the name that they want to call it. But when my wife was pregnant with our first child, so our oldest son, she was told that she was experiencing a geriatric pregnancy, not something to tell a pregnant woman. All right. And then also what happens is that they have high levels of FSH, okay, so follicle stimulating hormone. And the reason they have higher than normal levels of this hormone is that it takes more work, more energy, more effort to produce and maintain that follicle and help it mature so that it can release the ova. Okay, so this is a difficult time, and for women, even if they don't want to get pregnant or have another child, this can be really difficult because now they can. It's one of those things like, I'm upset because I can't do something, not because I wanted to do it, but because I can't. And so it can be very difficult for women who go through or when they go through menopause. Probably a better way to describe that. Men experience andropause, okay? And it's not the same. All right, so as men get older, their testosterone levels decrease, but it's a relatively slow process. And really, it doesn't have any effect on sperm production until they're extremely old. So I would say 70s, 80s. Okay. But one of the things that we do know is that while they still produce sperm, the quality of those sperm decrease as age increases. However, it's not impossible for a relatively old man, an extremely old man, to be the father of a child. Okay. So, men can always have, once they hit puberty, they can always be a father, whereas women, once they hit a certain age, it's just not possible for them to have another baby. And so we're going to end with birth control here. And so there are multiple different types of birth control. Okay, so you've got abstinence, which is the I won't say the easiest, but it's the only one that guarantees a baby will not be born. Okay, if penis and vagina don't get together, don't come in contact, aren't anywhere near each other, can't have a baby. Okay. Then there's sterilization, barriers, implantation prevention, and hormone treatment. Okay. Whoops. So abstinence, like I said, that just means no sex. If you don't have sex, you can't have a baby, right? And I'm sure that some of you, all of you, I don't know, have, when you had the maturation topic, that abstinence came up. It's highly effective if you can do it. Then there's sterilization. So this is something that's hard to reverse. So men can get a vasectomy, women can have their tubes tied. This is not 100% effective. I know I have somebody that I know that had to undergo a vasectomy because their wife had some, all of a sudden name escapes me, but it could have been dangerous to her health if she got pregnant again. And they went to the doctor after the vasectomy, like a couple of years later, and they took a sample, and there was one sperm in the sample. That's really frightening because one sperm is all that it takes. All right. And so, 1 out of a billion or whatever, there's still that chance. Tubal ligation, you're getting rid of some of the tubes. That doesn't always guarantee. And in both cases, while it doesn't guarantee, it's still really, really, really effective. Okay. Then there's also barriers. So this is the ones that most people are, I think, familiar with. So this is where condoms are diaphragms, so making it so that the egg and the sperm can't get together. You have implantation prevention. So this is IUDs. So an egg can get fertilized, but hormones are released to prevent the fertilized egg from actually implanting in the uterus. And then finally, you have hormonal treatment. So this is like the pill. And what the pill does is it prevents the release of GnRH, which prevents the release of LSH, FSH, which means women won't ovulate. And if a woman doesn't ovulate, then they can't get pregnant, right? But again, it's not 100% effective. And if you miss a day, that can cause problems. All right, so here we go. 3 things that I hope you know how to do or can describe or explain at the end of this lecture. Just 2 more to go.